Today, we're discussing another single tablet regimen that has become an important consideration in HIV landscape, Symtuza. Hello everyone and welcome back to episode 29 of the Sex It Bites podcast. I'm your host Abhishek, a specialist pharmacist in HIV and sexual health. Picture a young professional called Daniel in his mid-30s, navigating the bustling streets of London. He is constantly on the move, meetings, deadlines, and perhaps a late evening dinner plan. Aside from juggling a myriad of responsibilities, Daniel has a challenge he grapples with daily. He has been living with HIV and his treatment journey has not been smooth. He takes 3 tablets for HIV on top of other medications for blood pressure and cholesterol. Managing multiple medication can be a maze. In the past, in moments of intense stress, Daniel occasionally stopped his treatment, leading to an elevation in his viral load and resistant HIV strain. What he longs for is simplicity, fewer pills, and an effective treatment against HIV. Enter Symtuza, a beacon in this scenario, offering a simpler, consolidated approach to managing HIV, making it an excellent choice for individuals like him. Symtuza is a formulation that combines 4 agents, 3 of which are active against HIV. The active agents are called tenofovir alafenamide, emtricitabine, and darunavir. And then you have a 4th inactive agent called cobicistat, whose sole job is to boost the levels of darunavir in the body. Hence, it is also sometimes called a booster. The beauty of Symtuza lies in its simplicity. It's delivered in a single daily pill, offering convenience for those seeking an effective treatment. If you or someone you know who is taking Symtuza, it is important to understand it as well. To get most out of its benefits and handle any side effects, it's good to know how Symtuza works. So let's dive deeper into what Symtuza is all about. The optimal way for taking Symtuza is once daily with food at around same time every day. A couple of hours here or there will not make a huge difference in the grand scheme of things. You should take Symtuza within 30 minutes of eating a meal or a snack. The type of food is not important. The tablet can be taken with water, milk, or any nutritional drink. The tablet should not be crushed or split in half, but swallowed whole. Symtuza, like other medication, has its share of side effects. Side effects are your body's way of saying that it is adjusting to the medication. These side effects are typically most noticeable when you first start therapy and generally decrease over time as your body adjusts to the medication. And for all you know, nothing might happen to you. However, if any of the side effects persist and become bothersome, please contact your pharmacist or doctor to talk about side effect management or other suitable alternatives. Some of the most common possible side effects are diarrhea, stomach pain, indigestion, headache, dizziness, changes in cholesterol levels, changes in your liver or kidney blood tests, rash, tiredness, nausea, and vomiting. Speaking specifically of nausea and vomiting, if you vomit within 2 hours of taking the tablet, take another tablet the same day and then take your next dose as usual the following day. Now, let's look at what to do if you miss a dose. If you forget to take Symtuza and notice within 12 hours of your usual pill taking time, take the tablet as soon as you remember it. Then take the next dose at your usual time the following day and carry on. However, if you notice after 12 hours of your usual pill-taking time, then do not take the missed dose. Wait and take the next dose at your usual time the following day. The important thing to note is not to take double dose the following day to make up for the missed one. On the flip side, if there is a rare event where you overdose on Symtuza, it is essential to seek medical help immediately, especially if you are experiencing side effects. Let's now look at another very important aspect of taking HIV medication called drug interactions. Symtuza can sometimes interfere with how other drugs work and vice versa, a phenomenon called as drug-drug interactions. These include, but not limited to, medication for cholesterol like statins, certain anti-seizure medication, steroid-containing medication including inhalers, creams, nasal sprays, injections, and eye drops, certain antibiotics against tuberculosis like rifampicin, certain medication used to treat depression, and so forth. The actual list is quite exhaustive. Hence, it is absolutely vital to make your doctor and pharmacist aware of any other medication you take, including over-the-counter medication, vitamin supplements, herbal products, and even Class A drugs like cocaine, ecstasy, crystal meth, etc. to ensure that they are compatible with Symtuza. Remember, it is in your best interest to ensure that these interactions are effectively managed, as this will contribute to the effectiveness of your treatment and your overall health. It is also vital to note certain other considerations when taking Symtuza, or indeed any antiretroviral therapy. When it comes to consuming alcohol, caution is advised, as heavy drinking may impact adherence and can also make it more difficult for the liver to process these medications. As for pregnancy and breastfeeding, till the point of recording this podcast, Symtuza is currently not recommended in pregnancy or if you are breastfeeding. If you become pregnant whilst on Symtuza, your doctor should switch you to an alternative regimen. Symtuza's introduction and widespread adoption shows how much HIV treatment has improved over time. Its efficacy, combined with convenience, underscore the great stride we have made in HIV care. So that's it, folks. I hope you found this chat about Symtuza useful and it has given you some valuable insights into this single tablet regimen used against HIV. However, a final word of caution. This episode is meant to inform and not to substitute professional medical advice. Always consult with your healthcare provider for any health-related concerns, and do not stop taking your tablets or make any changes to your regimen based on something you have heard here. If you believe that you have a medical emergency, please seek immediate attention from your doctor. In our upcoming episodes, we will continue to explore other treatment options and strategies in the world of HIV. Please remember to follow us on Twitter at RealSexAdBites and me personally at PharmIDExpert for more updates. Until then, stay curious, stay informed, and most importantly, stay safe. I'm your host Abhishek, and I'll see you in the next episode.